Welcome to Transformation Tuesday from the General Practice Manager Register. In today's episode, we are focusing on one of the biggest developments currently influencing primary care, the continued growth of remote monitoring and virtual care, and how practices can use these approaches to support patients more proactively. Across the NHS, there is increasing focus on using digital technology to help patients manage their health outside traditional healthcare settings. Remote monitoring tools, digital consultations, and connected devices are becoming more common, particularly in the management of long-term conditions such as diabetes, hypertension, respiratory conditions, and heart disease. For general practice, this represents a significant opportunity. With an aging population and increasing numbers of patients living with multiple long-term conditions, practices are looking for ways to provide safe, effective care while managing rising demand. Remote monitoring can support this by allowing teams to identify changes in a patient's condition earlier and intervene before problems become more serious. However, successful implementation requires careful planning. Technology alone does not improve care. It is the processes, training, and support around that technology that determine whether it delivers meaningful benefits. One of the biggest considerations for practice managers is workflow redesign. Introducing remote monitoring changes how information enters the practice. Instead of patients attending appointments when problems arise, teams may receive regular data that requires review, interpretation, and appropriate action. This means practices need clear processes around responsibility. Who reviews the information? How often is it monitored? What happens when results fall outside expected ranges? When should concerns be escalated? Having clear answers to these questions ensures technology supports safe care rather than creating uncertainty. Another important area is staff training. Different members of the practice team need confidence in understanding how digital monitoring systems work and how they fit into existing clinical pathways. Training should not only focus on using the technology, but also on understanding how it changes communication, workload, and patient management. Patient engagement is equally important. Not every patient will feel confident using digital tools, and some may require additional support. Practices must ensure that virtual care improves accessibility rather than creating new barriers. A successful approach combines digital options with traditional methods to ensure patients receive care in the way that best meets their needs. Remote monitoring also creates opportunities for more personalized care. Instead of relying only on occasional appointments, healthcare teams can gain a clearer picture of how a patient's condition is changing over time. This allows interventions to be more targeted and supports a more preventative approach to healthcare. For practice managers, reviewing data will become increasingly important. Understanding how many patients are using digital pathways, how much clinical time is being saved, and whether outcomes are improving allows practices to evaluate whether new approaches are delivering value. Technology also provides opportunities to improve patient independence. Supporting patients to understand and manage their own health can improve confidence and encourage greater involvement in decision-making. This aligns with the wider NHS focus on personalized care and empowering patients to take an active role in managing their well-being. However, transformation must always remain focused on people. Digital tools should enhance the relationship between patients and healthcare professionals, not replace the communication, judgment, and reassurance that are central to general practice. Strong leadership will be essential as virtual care continues to develop. Practice managers will play a key role in ensuring teams are prepared, processes are effective, and technology is introduced in a way that genuinely improves patient care. Transformation Tuesday reminds us that the future of primary care is becoming increasingly flexible and connected. By embracing innovation while maintaining strong governance, effective training and a patient-centered approach, practices can use remote monitoring to create more proactive and sustainable models of care. The General Practice Manager Register continues to support practice leaders by sharing practical insight into emerging developments, encouraging collaboration, and strengthening leadership capability across primary care. Thank you for joining us for this week's Transformation Tuesday from the General Practice Manager Register. We look forward to welcoming you again next week.